Hi, I'm Carolina, your podcast host and womb healer, and today we're having a very special guest. This is Dr. Carolina Sueldo, and I'm going to go ahead and hand her introduction over to you. Thank you so much for being here. Thank you for taking the time to speak to us.
Absolutely. Thank you so much, Carolina. I'm so excited to be here today. So as she mentioned, I am a doctor. I'm actually a double board certified OBGYN and fertility specialist. So what that means is after medical school, I did 4 years of OBGYN training. I then did 3 more years of reproductive endocrinology and infertility. And then for both specialties, you have to take a written exam and an oral exam. So lots of training to get to this
That's
spot.
so impressive.
Thank you.
So let's dive into it. Let's dive into birth control. So birth control is such a hot topic here in 2022, especially here in the States. And most women have encountered or have done some type of birth control. Does birth control cause irregular cycles? Is that a myth?
Yeah, I love this question. I love this question because I get it so much. And I think there's so much misinformation out there about birth control. I'm so glad that we're talking about this today. So the short answer is no. Birth control does not cause irregular cycles. And so I'm going to expand upon that. But the short answer is no. If you have any takeaway,
it's a fat no.
For your listeners, if there's any hesitation, there is no hesitation. Okay. So it does not cause irregular cycles. Basically, what happens is that when a patient presents either with irregular cycles or painful periods, or there's any number of things, one of the first line treatments that we use is birth control. And a birth control pill has both estrogen and progesterone hormones. And so for women with painful periods, that progesterone, if there is endometriosis, that progesterone will have a suppressive effect. For patients with irregular cycles, we'll give them a nice, predictable monthly bleed. When you come off of the birth control, you go back to whatever your baseline was. So if your baseline was irregular, guess what? You're going to go back to being irregular. If your baseline was painful, you're going to go back to having painful periods. Now, the third thing is most women use birth control as just that, as birth control or contraception. And many women tend to start it in their teens because that's when they become sexually active. And many of us, myself included, continue it for years and years and years. So really, the first time that you're taking note of your baseline, non-hormonal menstrual cycle is when you're now coming off to try to get pregnant. And so really, this is a first time or first assessment of what your baseline fertility is or your baseline cycle regularity is. I will say, I think it's super important if a patient presents with symptoms. So she's not just presenting for birth control as a birth control method, but she's presenting with irregular cycles or painful periods or whatnot. I do strongly believe that a complete evaluation needs to be done. So there's hormone testing that needs to be done. There's an ultrasound that's typically recommended. We're trying to identify the underlying cause for her symptoms, right? So you don't just want to throw birth control at someone just because. You want to be thoughtful and intentional as the physician in terms of your workup and your treatment. That said, birth control is a great first-line treatment for many of these ailments. And so a lot of physicians will use birth control as that first-line therapy.
I'm going to pause you there. For the ladies that are listening, I want you, when you're going in to your OBGYN and you're suffering from whatever it may be, whether it's irregular periods or maybe you're bleeding too long or whatever it may be, you have the right to ask for what is the reason behind this. If your doctor is going to ask you not do that testing or not do a complete evaluation, pause and ask questions and learn to advocate for yourself. You're allowed to ask questions in your doctor's appointments. And doctors are authority figures, but they are also people and they're serving you. So I find that a lot of my listeners, they don't advocate enough yet for themselves in doctor's appointments, are not brave enough, ask their questions in appointments to get to the answers. They leave with more questions than they came with. And I just always want to preface that you're empowered to ask things so that you have questions, and that's what they're there for. So
absolutely. I can't tell you how many times patients will come to me on a treatment and they don't really understand even why they're taking the medication. I will say for most physicians, I know I speak for most of us, obviously we went into this to help people, right? So we went into this to help, to improve, to treat, to cure, etc. All the positive verbs that you can think of. And so most of us will never dismiss you or your symptoms or your questions intentionally, right? The vast majority of the time, it's never intentional. And so really, I couldn't be more aligned with what you're saying is feel empowered to ask those questions, feel empowered to understand, why the treatment plan is being recommended or, why you're receiving, this or that medication.
And then what's the next step? So like I do this medication, when do we check in again? When do I see you again?
Right.
Like what's next step? So you actually have a plan. Sometimes I'm like, okay, I have a discussion with a client like either in my membership or my group program. I'm like, okay, so what's your fertility plan with your doctor? What do you mean a fertility plan? Like, what are the next steps? Like, what are you doing?
Right. Where are we going with this?
Where are we going? Because we have goals here. We got babies to make. So like, what is your plan? So it's okay. Sometimes it takes a while for like a plan to be put together because you got to do the test. You got to like find out answers and then move forward. But we're always working towards that plan. So
absolutely,
this is a very popular question. Is birth control the reasons why my cycles are now irregular?
Yeah, so this is a question that I get all the time, and I'll kind of parallel that with, is this the reason my cycles are irregular? Is this the reason I have infertility? I took birth control for whatever,
decades,
10 years. Is this the reason that I'm now having trouble? And the short answer is no. For most women, whether they were put on birth control as a contraceptive method or whether they were put on birth control for, an underlying ailment, the idea is that now that you're off of the hormone suppression, we are seeing what your baseline fertility is. And your baseline may be irregular cycles because of PCOS or, any number of other issues. Your baseline fertility may be really painful periods because of endometriosis. There's a whole host of things that are now going to pop up because you don't have that suppressive birth control. So the short answer is no. Birth control does not cause irregular cycles. It does not cause infertility. And really, there's no waiting period. So if you were on a birth control pill, different with some other forms like the depot shot, but for most birth control forms, including the pill as the most common one, when you stop the pill and you get a period from that stoppage, you really return to your baseline fertility. So there's many women who even get pregnant that first month right off of birth control.
I love that so much. Thank you so much for your time today. And can you tell our listeners, are you on social? How can they follow you? How can they learn more about you?
Yeah, absolutely. So I have a YouTube channel. I drop episodes there weekly. They're just quick 10-minute clips of those little blurbs that you wish you knew. And it's my name, Dr. Carolina Sueldo. So very easy to find. And then I'm also on social. I'm on Instagram and Facebook. I would love for you to send me a DM after this episode and let me know what you thought about it. And if you have any questions, I would love to work with you.
I would love that. I love also that we're twinning with our first names. It's Carolina, the two Carolinas. So I'm so blessed to have had you here today. And thank you so much for your time.
Absolutely. Thank you so much for having me. This was so fun.
Awesome. I hope you have a good day. It was an honor to connect and serve you this week. If you're a spiritually curious person wanting to conceive and heal blockages in your fertility, click the link in the episode description to learn more about the Fertility Foundation Collective. This October and November, all new members will be learning how to heal themselves with Reiki to boost their fertility. Make sure to grab your seat. Until next time, my friend, know you're loved.